of detransposition of great arteries. In this image, this is left atrium, this is left ventricle, this is right ventricle, this is interventricular septum, and this is pulmonary artery, and this is aorta. Aorta is big and valve is normal, and pulmonary artery is very small in size. Valves are hypoplastic, and you can see subpulmonary portion is quite narrow. That means infundibular stenosis. So ultimately, significant subvalvular and valvular stenosis is here. Detransposition means pulmonary artery is coming almost all from left ventricle, and aorta is coming mainly from right ventricle, but less than 50% of aorta is also coming from left ventricle. This case is called detransposition because pulmonary artery is coming from left ventricle and aorta is coming from right ventricle. That is why we call it detransposition of great arteries, because there is AV concordance. AV concordance means left atrium to left ventricle and right atrium to right ventricle. And then aorta, this aorta is from mainly right ventricle, and pulmonary artery is mainly from left ventricle. So it is called detransposition of great arteries. This is next view. Again, you can see this is right atrium, right ventricle dilated compared to left atrium and left ventricle. Again, in this view, left atrium, left ventricle, and this pulmonary artery is coming mainly from, pulmonary artery is coming exclusively from left ventricle, and aorta is coming mainly from right ventricle. Some part of aorta is also coming from left ventricle. See the color flow through pulmonary arteries. Very narrow pulmonary artery, very narrow stenotic flow. This is the portion where you can see the flow. This is left atrium, this is left ventricle, and flow is going into pulmonary artery, and some flow is also going to aorta through BST. Again, the same image. Now you can see severely stenotic this part. See, this is very stenotic. This part, this is very narrowed pulmonary flow obstruction. You can see the pulmonary flow. This is, you can just imagine the cursor. See this arrow can show you this is very narrowed. So significant subpulmonary and pulmonary obstruction. Again, the next image. One thing you have to remember is to say whether the aorta is overriding, how much aorta is overriding, how much pulmonary artery is overriding. The view that will give you this determination is parasternal long axis or short axis view. So only parasternal long axis short axis view will give this thing, because in this view the structure is coming very close to the probe. Apical view and subcostal view or suprasternal view cannot give you exactly this thing. So if window through which you take image through subcostal window, apical window, and suprasternal window, any view cannot give you what amount of overriding is there. So to see the overriding, you have to use parasternal window and parasternal long axis view or parasternal short axis view. That view will give you exact thing, how much overriding is there. So in this image, you can see this parasternal long axis view. This part is left atrium, this is left ventricle, this is right ventricle, this is pulmonary artery. You can see the echogenic, so many things here. So significant pulmonary stenosis. So pulmonary artery is coming exclusively from left ventricle, and aorta is coming mainly from right ventricle. Is also coming, some part of aorta is also coming from left ventricle. So ultimately this case comes under D-transposition of great arteries because there is AV concordance and only VA discordance, then that is D-transposition. When you find AV discordance and VA discordance, both discordance, that will be corrected transposition, that is L-transposition. This case has got D-transposition of great arteries. Thank you.